Ready.
And we're live. Well, almost live. We're counting down to the live.
That's right. The Bob and Brad and Mike show. We're going to talk about foot pain and knee pain while you're walking. Some real nice tricks on how you can alleviate and actually fix it sometimes completely for future health, knee and ankle. So you don't get a knee replacement as you get into those age like mine where the hair is starting to turn gray. Anyways.
Well, I mean, age like mine, I don't even have hair.
Yeah. How's your hair ever going to turn gray? You just keep shaving it.
Facial hair, I guess.
All right. Yeah. So let's get back to the what are we talking? Oh, we do have an absolutely perfect day in Minnesota. The sunrise was beautiful. There's a few clouds, but it's sunny and 60 degrees without a bunch of wind blowing around. That we'll take it for sure. Let us know where you are and if the weather is beautiful there or not.
I'm going to steal the mouse here for a second. Thank you, Danny. Oh, we don't have any comments yet. Hello, everyone. You can let us know where you're from.
We got StreamYard.
And we got... oh, that's us.
That's us. Oh, wow. Had me excited for a while.
What was I going to say? I forgot. Oh, we do have a big announcement.
Oh, we do?
Coming here about a new product that is on pre-order. Pre-order started yesterday. We'll have some pictures coming up soon of it. It is the iMaster Pro massage chair. Now, this is a huge deluxe reclining type chair that's a full body massage and stretching. And honestly, I thought most of those are kind of gimmicky, but we got one here at the studio and I tried it and it is the coolest thing I've ever sat in.
You know,
there it is.
Last Friday, I sat in it and I wanted to get a massage. It's a 20-minute timeout thing and it stops. I got through it and I went through it again. I spent 40 minutes on that thing before I went back home. It was fun. Anyways.
It's raining in California.
Oh, really? Really? Oh, look at we've got all. Okay.
Yaya says, good morning. My heart's in Japan. Says 10 miles a day and my ankle hurts bad. Well.
Ooh, well, maybe we can help you out there.
Maybe back off on the mileage for a little bit so it doesn't hurt as much.
Yeah.
Donnie says, hello from Minnesota.
All right.
Hello, that's where we're at.
Fellow Minnesotan. Very nice.
North Carolina, Garden City. What's GA, Georgia?
Georgia, I think so. That's exactly
I don't know what else it would be.
Yep.
Amanda. Hi, Amanda. I got Diane from
Chico, Northern California.
Willie Cat. It's from
That's
Boise,
a
Idaho.
nice name. I like that.
46 degrees and rain. Wow, it's raining everywhere else. Oh, it's clear
here. I think we're supposed to get rain tomorrow.
It's raining here.
Well.
Thanks for ruining that cameraman, Tanner, telling us it's raining later today.
Yeah, well, that's all right. We got to have a little rain.
Hello, Nick from Cincinnati. Beautiful weather. Rhiannon from Tennessee. Sorry if I butchered your name.
Joanne from Santan.
Santan Valley, Arizona.
There you go.
Flora from San Francisco. Jamie's from Benton. Hi, Jamie. Hi, Candy. Sorry, we have everything. We have so much stuff on our screen. The names are kind of small. We got to squint a little bit. Candy from Washington State. 38 degrees. Ooh, cooler
Look at
there.
that. Nick from Cincinnati, Ohio.
We're warmer here in Minnesota.
Mm-hmm. Well, anyways, should we give a little preview? We're going to talk. We got this divided into sections because the foot and the knee oftentimes work together.
Sorry,
France. That's a big deal. We're going to divide it into footwear, talk about support initially, and then we're going to get into some stretching and flexibility. Tight muscles can really cause some problems in both the ankle, foot, and the knees.
Michael, can you tell us how to say hello in French, please? We're going to butcher it, but still.
Yeah.
Oui is not hello.
Well, you know.
That's yes. Bonjour. Oh, bonjour. Oh.
Strengthening and stability, some strengthening exercises for the foot, knee, and then we're going to go up into the hip a little bit because it's a big part of everything down below.
You know, I don't get out of the country much. I don't know these phrases.
Well, of course you
I've
don't.
been to Canada once.
Yeah, well.
Bonjour. See, they were right. Thank you, Michael.
Bonjour. I thought that was Italian.
It's French.
Oh, well, there we go.
Anyway, here comes the intro song.
Bob and Brad, the two most famous physical therapists on the internet.
And we're live. Hello, we're here. Oh, you're dancing to the
Well,
song?
I've got
ended already.
I got a few moves for that song. Let me tell you
You're more
that.
dancey than I am. Hello, TikTok.
TikTok is
We're
here.
live
There
there
we
too.
go. Hi, everybody out there. We're once again extremely excited. I took a few days off over the weekend, got away from everything, did a little fishing. I feel like a new man. There's one thing you need to do in life is take a break every now and then, so you don't think about work anymore. You think about just having fun with your friends, and then come back and you feel refreshed and juvenated.
Well, I had a friend come from. He lives in Vegas now, so he was up last
Oh,
week.
really?
So it was good to see him. Yeah.
Good job. Did he teach any gambling tricks?
Gambling tricks.
Well, Vegas.
No, he's not much of a gambler.
right.
Anyway, we're going to talk about 20 ways to stop foot and knee pain while walking. But as we mentioned earlier, we did start a pre-sale on the new iMaster Pro massage chair. If you order ahead of time, you actually get $500 off for the pre-launch date, which is in early November. Chelsea will comment what the exact date is on that because I can't remember off the top of my head right now.
And we're going to have some footage of this.
We
coming
do.
up.
We'll show it to you right now. Here's
Oh.
the chair before we get into it. So, Danny, please thank you.
Oh, there it is.
All its glory. Oh, you muted us. Just so you could see it, there are the adjustable stretching legs. There's Brad in there right now.
Oh, my feet are in there.
And
sure
it
enough.
massages and compresses. There's Brad getting a back massage and arms. It also does the head, neck. It actually reads your whole body before you even start getting massaged.
It literally goes from the neck to the bottom of your feet, and it's a nice, very nice done. It's we're very happy. I've been in them before a few years ago, and it's been a while. It's like, yeah, this is made properly, and it does exactly what it's supposed to do.
Yeah, it actually tilts in space too. It's very cool. It's like a space chair. Anyway, back at the topic on hand, should we get into some of these tips? And then if people have questions along the way relating to walking with foot and knee pain,
right,
just let us know, or walking pain in general.
Yep.
We try to stay on topic. If you have other questions and we got time, we'll try to answer.
Sure.
But
And walking is probably the most used exercise mode for people 50 and over. It's a wonderful thing to do. Keep walking. We're going to talk about footwear in this part as well, because sometimes you're out walking, getting good exercise, but if your footwear is either wore out or maybe the wrong type of footwear, you can actually be causing some problems over time. So we'll get into that in just a little bit, but that's a critical part.
So you wanted to start with walking is pretty common for most people as exercise in their 50s, but some people still run and jog.
This is
too,
driving
as well.
me crazy. You get that mic down.
Thank you.
Yeah.
Are you my producer? Or anyway, you're gonna talk about how you went to see your doctor, and he told you
yeah,
silly.
I did for a physical. I went to the doctor, and I still do run, and he says, why are you still running? You're going to wear your joints out. Walking's not so bad. Of course, naturally, as an avid runner, I disagreed with him, but we left it there. But walking, yeah, you're going to have excellent exercise for your body, particularly hips down, and get outside and walk. Treadmill walking's, a fairly good option, but boy, if you can get outside in a desolate place and not in the middle of traffic, it's a good thing for the mind.
Yeah, walking. Treadmill is fine, especially during winter or if it's slippery out, cold conditions, or if it's extremely hot and you don't want to be dehydrated. But if I'm being honest, I find it quite boring. So I would much rather walk outside and get some fresh air.
All right. Well, should we get right into it? We talked about footwear. We mentioned it, and let's do that.
So the first thing to look at is the shoes you are wearing. Now, there's many types of brands, many types of styles. You want to make sure it's something that fits you right. Personally, Brad and I wear wide toe box shoes with 0 drop. So meaning the forefoot to the heel is the same height off the ground. These are an example of that. There's lots of brands. These are pretty inexpensive ones from Amazon, just called Wittin, Whitin. I think these were like $45. I just wear them as everyday shoes. You can get ones that have way less cushioning than this, or just as much or more, and it can still be 0 drop. Wide toe box just means you have room for your toes to spread like they naturally should. If your shoes are scrunching your toes in, they're not really meant for you. I'm not saying you buy your normal favorite shoe brand in a wide version. You need to look for brands that have wide toe boxes. And we actually learned this from a podiatrist I interviewed a few years ago named Ray McClanahan. So I'm not just making this up.
Yeah, actually, he talked about he changed his foot practice to everyone that he treats. They have to get wider toe box shoes because of their problems, because that is oftentimes either causing the problem over the years or contributing to it. Here's a good example. Your typical shoe, this is a walking or running shoe, pointed here, squeezing those toes and forefoot together versus, this one, which is a wide toe box. And if you look at the cutaway where your feet and your toes get cramped up in here, much less room in here, and this is much more spread out. Makes a big difference on the mechanical forces in your toes and your forefoot, causing bunions, hammer toe, things like that, as well as circulation. You need circulation in the foot, and shoes are a key part. Tight shoes, no good. Get the foot so it can spread out and actually breathe and circulate.
And the elevated heel is going to actually shorten your calf muscles over time. So they're going to become tighter, which can be very problematic. And it also makes you put more pressure on your forefoot. It also teaches you to heel strike more with a straight leg out in front of you when walking, which can be very problematic for most people over time. A lot of people do heel strike. Which can cause joint pain issues in your ankles, knees, hips, all the way up. We might talk about walking a little bit later.
Yeah, we're at that scheduled in, so we will
get into that.
Demonstrate and show you that technique. I wanted to talk. What were you going to say?
Someone just talked about flat feet. We'll get into that later.
Yeah, that's another topic. We just did a video on that.
Yeah, we've done video on more foot health recently and flat feet, and we actually just put a a video out on shoes, specifically why your favorite shoe is ruining your foot. We'll link that video if you want to check it out more.
There you go.
We get into much more detail on that, but we have a lot of stuff to cover today, so let's continue on.
I just want to say one thing. If you're considering changing your footwear and you need a new pair of shoes anyways, is a good time to do it. Actually, if you get the zero drop shoes, that means the distance here at the heel, and this is a shoe that's been cut away so you can see it at the forefoot, is the same. That means zero drop. Usually the heel is a little higher inherently on most all shoes. And it may not be a lot, but it tightens up the calf, puts more stress through the foot as well as in the knee as a result of that tight calf. That's why zero drop shoes are helpful. This is one thing. Here, look at this. These are my zero drop shoes I bought a couple years ago. They're really nice, got the wide toe box, but they're thin. And every time I would walk or run with them, if I stepped on a little piece of gravel or a little stone, a little uncomfortable. So my advice, if you're starting this, Mike, you can add in too, but get zero drop, but
like the ones I have.
Get the cushioned ones.
Yeah.
It's the same distance, but it's cushioned. You'll find that easier way to transmit.
And you may have to wean into this if you're really tight and have a lot of foot issues. So don't wear them all day, every day, especially if you're having increased foot pain, because it makes you work your intrinsic foot muscles a little more too, especially if you get the minimalist style like this. So slowly get acclimated to them. Definitely just start with walking if you're a runner. Do that first before you start running in them. That I personally walked in mine for a few months before I switched my running shoes to these, and I didn't have any issues. Then when I switched to my running shoes, I didn't have any foot or injuries.
Yeah. One thing I do want to mention, maybe we should get into this. There's a comment about toe spacers.
There's toe spacers. You have to usually wear a wide toe box shoe to wear them. In your shoe, many toe spacers that are cheap on Amazon you can wear, but you have to sit.
Do we have a pair?
We do have a pair.
I wanted to get rid of them anyway. So, but no,
do you want to talk about high heel shoes?
Yeah, he's going to get a sample of toe spacers. But yeah, that can be very helpful. I was just looking at someone's foot this weekend. You go with a group of friends and inherently you get asked some questions about therapy personally. So toe spacers, I was looking at a 72-year-old person and his feet were all scrunched in. His toes are packed together like a lot are. Sometimes the toes are crossing over each other as a result of long-term wearing of pointed shoes. Now, if you have, I think they're called pumps. You get a pair of shoes that have high heels, 1 or 2 inches. Those actually make it worse because your foot, from the weight of your body, slides in and forces your toes into that pointed area even worse. And that can be a big problem with bunions. Oh my goodness, I saw some, some serious bunions. And surgery oftentimes is what's needed to take care of that. And the surgery, I'm not sure what the
I have a lot
outcomes
of
are.
people in my family with bunions, and I
Yeah,
thought genetically I was headed that way, and then I changed my footwear and realized it's your shoes.
you realize you got that upside down.
Why it works? I got it in there.
Yeah.
Anyway,
And maybe it doesn't matter.
so these are just some cheapo ones from Amazon. You can't wear these when you're walking or anything. You have to just sit around. And if I'm being honest,
You can walk a little bit with
they're
them.
kind of aggressive. There's like a really big gap between all of them. Like my piggy toe feels kind of weird.
But it's doing a nice job of stretching them out and getting them wider apart.
So these ones, other ones that I have in my hand are called correct toes. These ones you can actually wear in your shoes. You put them underneath your socks. If you have toe socks, you could put them over the socks then. But you just put them in, and then you can actually wear these while you are walking in your shoes, but you obviously have to have wide toe box shoes. So if you're really struggling with some toe gaps, you can try this out. It's just an option. So
Yeah.
these are actually made by Ray McClanahan, the podiatrist we talked about.
These you can, I have them in these shoes actually. And I went run with them, and it's not a problem to run with those. You may have to trim a little bit. They're made for that. It's easy to do if there's a wide. If it's too wide, you'll feel it where it needs to be trimmed. But you get them to fit your foot right. Walk with them, run with them, and it's a good way to work with your toes and keeping them where they need to be. When you're a child, if you ever look at a child, a few months old, look at their feet and their toes easily can go like this. There are muscles to make your toes go like that. I can't do it at all, but Mike, look at that. Mike has trained his. Look at it. He's got his muscles working good.
I can. Yeah, I started this 4 or 5 years ago, but
he's got healthy feet, healthy toes.
Kimberly is asking about leg length discrepancies. Fortunately, first off, make sure you have a leg length discrepancy, because some people think they do, and realistically, they have really tight muscles in their back and hip, which is like hiking one side up pretty bad. So if you do have a true leg discrepancy, unfortunately, there's not a whole lot to do about it. Oftentimes, people have to get one shoe taller than the other to make up that height difference. And sometimes it happens after surgeries as well, like if you had a hip or knee replacement. So fortunately, there's not a lot of good information we can share of things you can try on your own.
Well, so I agree with Mike that leg length discrepancy can be hard to judge just by looking at it. The best way to know if you have a leg length discrepancy is x-rays from here down. And if it's the bone is actually, humerus, whatever, is one leg's longer than the other. A lot of people, if they're born that way, and if it's not too great, your body may adjusted to it and it's not a problem, or maybe it will become a problem later in life. But if I stand like this and I hike my hip up, now all of a sudden this foot is in the air and it is an apparent leg length discrepancy. So like Mike was saying, muscles back here get tight, hike the hip up, and then you have a misleading or an apparent leg length discrepancy, but it's not true. It's just a matter of getting the pelvis so it's level and everything else levels out. That kind of thing is something you're going to need to see a therapist or a doctor, and they're going to have to do some really close assessment to determine.
Hers happened after a knee and hip surgery.
Ah.
Yeah, sometimes when you get that space back in there, if your other side is still natural, it's just longer. Unfortunately, yell at your surgeon. I can't really tell you a whole lot about it. Otherwise, if you need the other side done, make sure they make them even. Otherwise, building up one shoe is what I've seen kind of work. It's just unfortunate because you always have to wear that one shoe.
Well, if I've done it with people I've had that, and let's say they're
depends on the height,
1 centimeter difference on one leg after surgery.
That's bad.
I would put in half of that, 50%, one half of a centimeter heel lift so that it compensates for the short leg. You don't want to go the full distance. You want to put partial that. And the rule of thumb, 50% from my experience and what I've learned. And, hopefully that can take care of it. It's one of those things, it's hard to do on your own. It takes probably someone who's dealt with it and has some experience, a professional, to help you guide through it. So you don't put too much in. And like Mike said, then you have to have that heel lift in all your shoes. So you got to buy a whole bunch of them or take it out of one shoe, put it into the next shoe once you get it dialed in, which is a little bit cumbersome.
What was I going to say?
Good questions, these people.
Yeah.
That's what I like about our audience.
Oh,
they're all above average, very intelligent people. Good questions.
People are asking about other shoes. So Witten is just these inexpensive ones that I have on. If you don't want to spend a lot of money, we linked it there. I own Ultras, ALTRA. They're more of a running, walking shoe. They're more expensive. You normally have to get them from their website, but they do have like a 30-day return policy if you don't like them. Zero is the brand, XERO, so you spell it. There's so many more than that. There's tons of them. Those are just ones off the top of my head I can think of. I can't remember what my other ones are, but just find one you like. I mean, we don't really work with any specific company. So
Bonnie is asking, can this video be found on YouTube? And yes, it can. It's going to be on YouTube. And so you can review it forward, backwards, go over things that you've missed from now until
forever.
Unless
the internet goes away.
What are you showing you?
Yeah, look in the live section on the
there.
YouTube channel.
Yeah.
You can rewind it while it's live too. You don't have to wait till later.
You mean right now they can rewind us?
Yeah.
Oh, really? How nice.
So another option, if you're having some leg circulation issues while walking, are compression socks. As you can see, I'm putting some on right now, and they're a little tighter when you try to put them on. But most of them are pretty generic. Obviously, if you have some weird issues like varicose veins, lymphedema, real significant issues, make sure you're cleared by your doctor to wear them. We don't want to cause some type of health complication. But if you're just in general, if your legs are a little sore or tiresome, I wear these a lot after I do like a long distance run for the rest of the day, just because it kind of helps with circulation in my calves and my feet. But they're just compression. Normally, what are they, 20 millimeters of mercury up to 30?
Yeah, it depends. I think the lowest standard one is, 20 millimeters of mercury, the compression around the foot and ankle, and then up here it's less, so that it makes the fluid go proximal or upwards towards the trunk, which it wants to do.
I don't even know what brand these. Where did these come from?
Well, I think
I have no idea. Yeah. They're just laying around here. Yeah, there's lots of brands, lots of companies that sell them. I mean, I have ones I just bought at Target, like at my house. So
yeah,
they work fine. After a while, you keep washing them. I don't dry them in the dryer. I air dry mine, so they last longer. But after you wear them for like a year or more, they do kind of lose some of the compression. So just a heads up. So I won't go spending, like $50 on a pair, but I have pretty inexpensive ones. So
yeah, getting them on is difficult for pretty much anybody.
Yeah, especially if you struggle to even reach your feet, or you have a lot of swelling. So
we do have a video on a nice little device. It's not very expensive, but how to get them on quickly. It's a little device. I don't know the name of it, but maybe Chelsea can find it in our videos and
You're talking about a sock aid?
Yeah, sock aid.
Oh, yeah,
but
sock aid.
There's more than one type.
Yeah, there's lots of variations.
Some work good and some not.
Some
so
you
easy.
slip on and pull up with the string. Some are more on the ground and you put your foot in them. They all kind of depend. I think we should get into some other things because we're already 20 minutes in and we haven't even talked about stretching.
But I think it's good we spent some extra time on footwear because it's so important. The only other thing I wanted to mention is your footwear can be wore out. And the way to check that out, I need a close-up here, Tanner, with my orange pointer, is on your shoes, there's going to be this black rubber here, or a darker color typically. It's black because it's got a lot of carbon in it, and there's some other stuff that's going on in there. But this is tough. That will not wear very quickly. And then this white is cushion. That gives you your cushion to protect your joints and make it feel good while you walk or run. But you need to look when on the edges, typically it's on the edges, when the black gets down to these other colored, in this case it's white, it's going to be a lighter color material. That's when it's wore out. If you look here, actually, this is Bob's old shoe. He wears around the ball of the big toe, the great toe. You can see right here the white. Is that clear, Tanner? That white is actually wearing. So these shoes are wore out. You can keep wearing them, but once they hit that point, the white starts to wear real quickly, and then you have some odd stuff going on with your shoes and the mechanics. So that's a nice little thing that a lot of people don't know is when is your shoe wear out, and it is when that area just gets down to the next
Our
layer
camera
of
guy
cushion.
sneezed his headphones off his head when he sneezed.
Mm.
So I was giggling. Anyway, we're going to talk about some stretching of the
Ooh.
leg muscles. Sometimes you can do this before you walk, after you walk, depending upon what you have tight. I oftentimes don't need to stretch before walking. Running, sometimes I do mobility stuff, but I don't static stretch much. But I do static stretch during the day. Or evening sometimes just to kind of limber up, so it can really help. So the first one we'll talk about are calf muscles, or calves,
Moo.
plural, muscles. I didn't say animals. So most people know where your calves are. They're right back here. You have two of them on each side. You have a gastrocnemius and a soleus. There's lots of ways you can stretch them out. Do you want to show the wedge cushion, or what do you?
Oh yeah, the wedge cushion is my personal
Or
favorite.
not a cushion, it's just a wedge. I was
All
thinking of
right,
leg wedge.
I'm sorry. So yeah, so you can do it with socks on. Anybody? I have a fetish for socks. Just to get off topic, just to
Fascination.
look at these nice roses. St. Croix socks are really nice. I really like. They're fun. Anyways, you know, enough of socks. But put your footwear on. You need to have your shoes on. If you get a wedge, that's about between 20 and 25 degrees, depending on how tight you are. But if you get anything between there, you'll be fine. But it has to have a sticky surface here. And it makes a humongous difference on how the quality of stretch you get. So this is going to stretch the Achilles, the calf, all this muscle complex in the back. And I simply relax and let my body weight go through it. Now back here, no stretch. I simply lean forward and the stretch gets greater and greater, and I can control it, and I can just hang out here, put your hand on the wall on something to balance so you relax more. And then that works the gastrocnemius. If we want to get the soleus muscle, the other major muscle in the complex, you simply bend the knee here and then put the weight through it, and you'll feel the change. I feel the stretch more here than there. 15 to 30 seconds. I like to do stretch on and stretch off. Mike is doing, this is a really nice method. If it works for you, is use the stairs.
Yeah, so go on the edge of a step. Normally for this, you probably want to have your shoes on because it's a little more comfortable on the balls of your feet. And then once you're on the edge of the step, start with both legs if you've never done this before. This is more extreme than that stretch, or even the next one we'll show you. So you just let your heels drop down off the edge, hold on to the railings. You don't want to fall. And you're going to feel a good stretch with this because gravity is really pulling you down. And the more you're on the ball of your foot, the more stretch you'll feel. Again, you kind of have to do this just with a straight leg. You can do it with bent knees, but it's a little awkward if I'm being honest. So I usually just do straight leg. And then oftentimes I'll shift one way and really stretch the one side out. And then I'll hold this for 15, 30 seconds. And I'll go the other way. And I'll just kind of go back and forth. I just get a real deep stretch in my gastrocnemius here. Another way you could do it is just standing. You can lean against the wall, countertop, railings, whatever you have. And just put one foot behind you. And then lean forward. If my leg is straight like this, I feel a stretch again in my gastroc region. If I want to hit my soleus, I bend my knee, and you're going to feel it a lot different.
Right there.
Just make sure your back leg, your foot is straight. Don't
What
let
kind
it.
of pants do you got, man? These are like really fancy ones.
They're
Wow.
nice ones. They're running ones.
Wow,
for
that's what I
outdoor
mean.
during-
Wow, you really are buying some nice clothing. Wow.
We're just starting
That's
a
what happens
fashion
when you're
show
single.
here. Anyway, you can switch to the other side. and stretch that out.
I was getting bored.
I
Sorry.
guess so. So yeah, just make sure you do both sides. But that's just some ways to stretch your calves out if they're tight. And I can guarantee you, most of you probably have tight calf muscles.
Now, Patty's got a good question. I don't know. You're a runner.
Peppermint
Do you
Patty?
run in the winter? No, it's
I run during winter. Yeah.
yeah. So she's wondering about footwear in the winter time. She's talking about the fabric type because I'm not exactly.
I normally wear the same shoes. I'll change my socks. So I'll have warmer winter running socks.
So you have a bigger shoe then, or
No, they're not thicker. They're just like a wool.
Oh,
like they're just like a
material.
light. Yeah, the
merino wool.
Yeah, I
I
buy
bet.
winter running
Yeah,
socks. So
yeah.
that's how I keep my
Yeah.
feet warmer. I don't have a specific I don't change shoe brands.
Yeah.
Obviously, running if you're going to be outdoors or walking, like I know where they clear the paths here in my town all winter long. So I'll use that predominantly unless obviously the snow is melted. Other than that, sometimes you can buy those little things you put around your shoe that grip more. They're rubber.
Crampon?
Yeah, and you just kind of put them underneath. You can walk and run in them. They're kind of weird to run in. I'd rather walk in them. But if it's more slick where you live,
Yeah.
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 That's
I
an
used
option.
to run in the winter, but I quit very quickly because I slipped on the ice and fell
Yeah,
down.
you have to take your time and make sure you got decent grips on your shoes, or go to a cleared path that you know is going to be clear.
Yeah, I
is
wish
the
we
biggest thing.
could give more information on that, but
Other than that, I don't have like a winter running shoe at all.
I-
Hamstring stretching.
oh yeah, the hamstrings. The hamstrings, a muscle group. Let's talk about it very briefly. If we look at the white stripes here, that if that was the hamstring that connect ischial on your bottom of your pelvis, ischial tuberosity, and they go down and they cross the knee joint. So
Bottom
if
of
the
the knee.
hamstrings get tight, they actually influence knee range of motion as well as your hip and your low back. They really have a lot of influence from down below the knee to above or belt line.
So stretching them out, there's lots of ways you can do it. You can do it lying on your back, standing up, seated, depending upon how mobile you are as a person. Lying down, you can just go on your back. If I'm going to do my left one here, I would bend my knee and then I try to straighten my knee as far as I can. I'm keeping my back flat. You see, I can't get it perfectly straight. That's just showing some hamstring tightness. You may feel it on the inside or outside, because you do have 3 hamstring muscles per leg, so they're all kind of a little different, but you can stretch this way. Oftentimes at home, I will actually put my butt right up to a wall, and then I just throw my legs up on the wall, and then I push them that way, and I'll just lay there for like 3 minutes, and that's how I get a good stretch. But you can do it lots of
You can do it on the Bob used to do this on a stairwell.
on a stairwell.
Yep.
You could do it that way.
Arr.
I like the wall because you can get both at once.
Yep.
And then I'll also sit in a deep squat, and I'll just sit there and because for me, it just takes some time to loosen up my hamstrings when I'm doing that. You can do it that way. Otherwise, standing, seated, all you have to really do is focus on straightening your leg out. So if you're really tight, sitting, just try to get your knees straight, and then you just hinge forward a little bit. Notice I'm not rounding my back. I just hinge forward a little bit and you'll feel a stretch. If you're not noticing much, you can throw your leg up on something a little bit taller, like a stool, and do it that way as well. Are you going to show that?
I wasn't listening to you because I was reading something, and
Throw your foot up on a stool like this. And you can get a stretch this way too. Just work the hamstrings, or you can go to the stairs.
Yeah. I
So
wanted to
just
mention, right,
throw my leg up on there.
while you're doing that, assess your knee. Someone mentioned this. That's why it reminded me of this really good comment. Is see if your knee can fully extend. Now this is full. This is a pretty good straight knee. Let's say one knee goes like that. That would be normal. Hyperextension means it's got to bend backwards. That's another consideration I don't want to get into. Most people don't have that. But let's say the other knee is tight and it only goes down this much. Here we got about an inch difference, maybe a little more. But this has a tight, the joint or the muscle, something is keeping it from full extension. And that can cause problems if you walk with that over time. And so you want to see if you can straighten that knee out. So what you're going to do is not going to get aggressive and jump on it, have someone push a lot of pressure on it, but just gently stretch above the kneecap, stretch and relax. stretch, and so you're going to get some hamstring stretch probably, and there's some other tissues in there that may be the problem. And again, no sharp pain should be experienced. Gentle stretching over days or weeks to get that, so both knees are the same. If you've had an injury or something of that nature that is the reason for this not extending, you may not be able to stretch through it.
Yeah, if you have really, I can only get my knee at like 45 degrees. You really need to work on your stretching then. Nostalgia, man. Is it 45 degrees from zero or only 45 degrees of bending? That's my question. That's
Yeah,
probably has some pretty bad
that's tough.
arthritis and tight muscles then. Which means you probably need an assistive device to walk a little bit better if you're bent that much. Anyway, do we want to talk about a little video clip? 5 ways walking is causing your foot pain with Bob in it.
Yeah, let's do that.
Okay.
We're going to talk about how you can use a lacrosse ball or a tennis ball on the bottom of your feet to get some stretching and some circulation, which is really helpful. Get those joints loosened up. Are you ready? Oh,
we're ready. So let's go to
all right. Here we go.
Each time you're pounding,
yep,
you're pounding on that foot. It's going to actually make things worse.
Right.
So,
yep.
All right. Where's my model, Brad? All right. The next one.
We don't have any models yet. We can't afford them.
Yeah. Well, we got a couple.
Oh, here we go. Oh, those.
You want to take these two?
Yep. I thought you meant like Jennifer Aniston or something like that.
No, we couldn't afford her. You know, she's worth like, I think, a couple $100 million.
Bob, you can't put a price on a person.
Yeah.
I read that in the book.
I'm talking about mobility in the foot. The foot, again, is made up of several bones here, and each of those bones is held together by ligaments. Well, if they're tight, they're not allowing movement there. Like, for example, if I'm not getting movement here, it's got to come from someplace. You're getting mobility from someplace, which means you could be overworking a joint.
Sure.
So you want to make sure all the joints are mobile and moving and healthy.
Right.
So a way to do that is very simple. Is you can take some type of ball that you have at home. You can use a golf ball. That's pretty aggressive. Yep. You can use a tennis ball. You can use a lacrosse ball. Now these were kind of made for these. They're a little spiky and they're plastic and they're hard. So they're actually probably more for massage of the foot. You know, the soft tissue.
Yeah.
But there you go. Brad's showing you the way that now that golf ball, isn't that? Yeah. So that's really probably getting some mobility there. If you're using a golf ball, and so I'd actually recommend using one if you can steal one from the golf course or.
Yeah, though people get in the pond, just jump in the pond.
That's right. That's right.
But yeah, and actually, I think it's nice to have different sizes.
Yeah.
And like this one is a lacrosse ball. If I use the tennis ball, it's a little softer, and you can do a little more with it, a little more pressure.
Yeah, you can push into it more.
Yeah. After you get used to that, you may want to go to the more aggressive one. So
what's nice, you can just, if you work at a desk, you can just have one below your desk.
Sure.
Or put it below your desk,
Yep.
and while you're working, you can go ahead and work that foot.
You have to take your shoe off, of course.
Yeah.
But you don't have to take your sock off.
Yeah. I would definitely give it a try if you've been having foot pain.
Mhm.
It's worth a go.
And we're back. So we're still rolling our feet because we're just having so much fun and everyone loves to see Bob. So we had to put that clip in there. Anyway, we're just telling the people on TikTok that you can do this with any type of massage ball you find. We have a cork version here, and then we have one with nodules and vibrates here. These are actually ones we put our name on, and we sell them at Walmart currently. You can get them in store. You can check on the website. Otherwise, you can order them online from Walmart as well. We're only selling them there for now. So those are some good options too if you find this beneficial. And they're pretty inexpensive for a nice foot massage comparison to like, a massage gun or a foot massager,
Right.
which we can also talk about. I personally like using the massage ball myself because it's less taxing on my fingers than actually manually massaging.
Mhm. Yeah, very, very good. And the other nice thing about these balls or any of the balls, you can use them not only on your feet, but on your calf, your hamstrings, your back. They're universal, so very handy.
Now, if you have a massage gun already and you want to use that, you can on the bottom of your feet to massage that same area. kind of the plantar fascia region. You can also do into the calf muscles, hamstring muscles, quad areas. But you can certainly go on the bottom of your feet. Normally, I use something that's not as aggressive as a massage head. So this one is foam and round. Brad has the
Airhead.
Airhead. Don't call me an airhead. Anyway,
and it's soft.
that was a movie from the 90s, Airheads. Anyway, it's got Adam Sandler in it. So just massage the bottom of your feet like this, dig in. You'll find different areas. Personally, me and my medial arch, I always feel it in there. It's just a good way. You can work into the calf muscles and play around with your range of motion while doing it. So I'm bringing my ankle up and down. You're going to feel it massaged in different regions. You can go inside of the calf. You can go outside of the calf, hammies, quads. You can do any which area. But sometimes just getting some massage to loosen up any tight muscles you may be experiencing. Someone talked about Pezan Serene earlier. I saw the question. Now, if you're real acute, Pezan Serene's medial, right? Yeah, it's on the medial aspect. So it's usually pain kind of in here. There's a bunch of muscle tendons that all kind of insert in this region. So you can kind of massage that region as long as it feels good and it's not all flared up at the moment. That's just a way you can kind of look at that to treat it as an option. So is there anything else you want to talk about these?
Well, yeah, the only thing I like, as far as Mike mentioned, you can stretch and massage your feet, which I think every time you put your socks on or shoes on, you take 5 or 10 seconds and stretch those toes out, get them loosened up a little bit, keep the circulation with a foot massage. An option I like at home is, I was just talking to someone about doing this every day for just a little bit. But if you happen to have a massage gun, we're going to get this going. And this has got the airhead, the soft head. This makes it so much easier. And you can work your toes, work the bottom of your foot. The arch feels really good for me. Just one of those things that, the massage gun you can use on from your shoulders down. You never use it on your neck or your head, but from the shoulders down, you can use it pretty much anywhere on your body, over muscles, not on your lymph nodes.
While you're massaging,
Whoa,
there's a few questions.
good.
Rico
Wow.
says, what are some good shoe brands for flat feet? Most flat feet, unless you have some genetic predisposition, are actually caused by weak foot muscles. So wearing zero drop shoes will naturally strengthen your foot muscles and you can start to develop an arch. Now, I'm not saying you're going to get high arches, but oftentimes Dr. Ray McClanahan kind of taught us that, the podiatrist, that oftentimes your feet are just weak and that's why you have no arch. There are some circumstances where people do have a genetic thing where they won't develop one, but yeah, we don't really have any specific brands for that. Then we have pretty specific question here. I have a lateral meniscus injury. I feel pain when I walk. When getting up from chair, can I continue walking? You're gonna have to let pain be your guide with a meniscus injury. Depending upon how severe it is and how new it is, oftentimes people will feel that catching or locking sensation. If it's newer, it could get better over time. But I've met people that have had surgery and haven't had surgery, and some of them just kind of learn, if they haven't had surgery, what causes it and what doesn't to lock up. So you're just going to have to be careful. And if walking doesn't bother it, then you can. If it bothers it, then you're going to have to figure out what you want to do going forward.
Right. You may have to go see the podiatrist, physician, therapist.
Well, you're going to have to see an orthopedic surgeon for a meniscal tear. Anyway, so I have pain on the top of my foot when I tie my laces toward meeting on the bend of my toes. That is preventing me from doing my walking better when I am sandals. What gives? Your shoes might be too tight. And it's limiting your dorsiflexion, I'm guessing. Laces towards meeting to the bend of my shoe that preventing me from doing.
Well, you think about that. I think we need to go on some strengthening exercises. That flat foot question. There's some simple exercises you can do to help strengthen and maintain strength in your feet. Very easy to do. Only takes 30 seconds or so. If you do them on a regular basis. Very helpful. So one of the things you get something to hang onto the wall, something to balance, and just, simply up on the toes so that you're pushing your toes in. Right now, I'm balancing with this because I want to emphasize toe strength. And then coming back, pull up and see if both feet go the same. Sometimes someone has weakness or tightness and they can pull up this far on this side, but this side not. And it's not there's a weak muscle here, it's that these muscles are tight for whatever reason. So, monitor that, make sure they're even and about the same. Push the toes in, go back like this. You get a stretch at the same time you strengthen the anterior or the muscles in front. Now the little muscles in the feet, keep your shoes on for this on the floor. And I call this the ziggy zaggy. Both feet go like this. Both feet go like this. The shoes, the rubber soles of these shoes are offering resistance. And that resistance is really good. Now, if you do this, and I'm already starting to feel those muscles on the bottom of my feet work, pushing my toes in, doing that. Now, after you do this for a while, you're going to get tired. But once you get used to it, if you need more resistance, just go on one foot. That makes a big difference.
Oh, look at
Yeah.
you.
Plus, you're working your balance. It's a win-win situation. Make sure you have a little bend in your knees while you do it, though.
Plus, you got a new dance move when you go out on
Well,
Saturday
there
night.
you go. You can, coordinate that with ballroom dancing.
You go ballroom dancing frequently?
Well, no, but my wife and I, we dance. We dance respectably.
That's
A
good.
little swing. You know what I'm saying?
Yes. Anyway, we're gonna do some quad and hamstring strengthening.
There you go.
Oh, some squats. So you can do squats lots of different ways depending upon your abilities and limitations. This is going to strengthen your legs up, which can help you with walking. Do you want the ball wall? I got to go get the ball then.
Oh yeah. That's a good thing. I'll talk about beginner squats.
One black sock and one white sock on.
I really like to use a chair for squats, actually any level. But the reason I like a chair is it gives you a distance where you're going to go down and control your movement. Some people, and if you're having difficulties and you're tired, it's a safety net so that if you need to sit and rest, it's safe.
The safety chair.
Armrest, yep.
Net.
So having a chair, a firm chair with firm armrest, is a really good way to do squats. And if you want to go advanced this way, or one leg is weak, you can take one foot up, just toe touch here or lift it up. And I'm going to go up on one leg to isolate strengthening one leg. That's something that a therapist will do with a person that's recovering from an injury or whatever, to focus on one leg. Mike, this is one of my favorite ones.
So you can use a ball on a wall. You can use a smaller kickball. It's just, I like the yoga ball if you have one available, or if you're at your gym and there's one. It helps you kind of slide down the wall easier. Most people can squat better when they have something on their back because they don't have good squat mechanics. So make sure your feet are roughly shoulder width apart. You can try having your feet straight ahead, or you can point your toes out depending upon what feels better for you. Just don't point your toes inward like this. And then you're just going to do a little squat. Do what motion feels good for you. If you're weaker or don't feel safe going down far, just do little partial squats. If you feel more comfortable, you can try to go down a little bit deeper, and then just make sure you can come back up. Don't expect people, unless you're younger and have the flexibility, to sit in a full squat like this. So just do what feels safe for you. You can certainly put your hands on your lap if this makes you feel more comfortable. Just try to keep a nice flat back against the ball. Don't round forward like this, because this just looks awkward and it feels awkward. If you don't have a ball, you can do it against a wall. You just don't slide as nice. So you can just go up against the wall, walk your feet out a little bit,
There.
and then just slide up and down like this.
A small one works pretty good.
Or you can use a kickball. You just got to find the right spot and just do. Boy, this is really flat. You want a little bit more inflated kickball for this one.
Well, some people like it that way.
This is more for stretching, but just some simple squats that way. Oftentimes you have good mechanics when you're either sitting in a chair or against the wall, if you're not comfortable doing squats. So
there was a nice little saying someone mentioned: if you ignore your feet like a loaf of bread, they will rise. And so I think we're referring to is if you're not exercising your feet, keeping circulation going,
bread on
you
your
could
feet.
get some like a loaf of bread rises. Well, your feet rise in the form of lymphedema and swelling. I think that's what they were referring to.
So bread is made from lymphedema.
See, my mom used to make bread at home, and I understand bread dough rises.
I've seen bread rise sometimes. My mom made bread sometimes. We had a bread making machine back in the
Well,
day
you
when
don't-
those were cool.
You don't see it rise in the machine, and when you're making it by hand,
Ours
you
had a
see it.
glass on top. You could see it rise. Anyway, enough about bread. So we're gonna talk about hip strengthening, specifically hip abductors, so lateral hip muscles. If these are really weak on some individuals, you may see someone do a waddle walk. So one of them might be weak. These muscles help you stabilize and stand up with good posture. Sometimes both are weak, sometimes one is weak. So it's good to work both sides. You can do this many ways. You can do it side lying, standing. I'm just going to show you a basic beginner standing one. Stand up. If you are very uncomfortable standing on one leg, hold on to something for balance. So what you do is just kick out to the side and then back in like this. We're just doing hip abduction, abduction. So we're going to kick out 10 to 15 repetitions, and then we're going to switch and do it on the other side. If you find this too easy and you don't need anything to hold on to for support, you can try adding resistance by using a band. You can use a band. Do you want this one? I can get another band. You're going to do the loop band.
Yeah.
Right, you can do a loop band. You can do a loop band. If you have a little cuff ankle weight, you can wear that too. If you have a normal band like this, you can do it this way. Don't shoot me with that. And then just kick out to the side. Normally the darker the color of the band for most companies, the harder the resistance. It's not always true, but most of the time it is. So you can try that. So Brad's got green on a little bit easier than that black one.
That one was way
Is
too
a lot
difficult
harder.
for me.
Again, try to kick out to the side. Keep your toes pointed straight ahead. Do not sway your body. Keep your trunk nice and controlled. And then I also have a little bend in my knee that is standing. This leg, I'm not locking it out straight. This is going to make your quad muscles fire a little bit harder. So that's a good way you can do it. You can do 2 to 3 sets of 10 to 15 reps on each side.
You know, I want to show a quick little stretch that can't do any harm, but I've had a couple people respond really well. They couldn't run, or even when it was bad, they had difficulty walking with pain on their knee. And it's simply an IT band stretch where you go like this. If this is a painful side, put your foot over the knee here, and then here or here, and pull that this way, and just stretch and look this way a little bit. Should not, if it creates any pain, particularly sharp pain, just forget it's not doing the right thing. It should feel like a good stretch. Stretching that IT band, easy to do. As long as you can long sit, that's sitting down like this. Not on a bed so much, better on a carpeted or firm floor.
I've done it like this too, where I actually put the
there
one
you
leg
go.
up and then I pull with my other leg over, and then I feel a big stretch here. Obviously, if your knee is more bent and coming up, you might feel a little differently. But this one feels good on me because I do have IT band syndrome from running on this side more. And oftentimes I'll just do this. I do lots of variations of IT band stretches, but this one usually feels pretty good for me. I really feel it pulling in here. My IT band tightness is normally in the lateral hip. Some people will get it more in their lateral knee because that's where the whole IT band runs. So you can kind of mess around with different IT band stretches. Our next thing we are going to be talking about is... Oh, we did talk about ankle stability. Do you want to show? You wrote a wobble board. Do you want to show a wobble board?
Oh, yeah. You know, I didn't want to. I don't know about talking because most people don't have one.
Yeah.
But they are really nice and handy. So wobble board is used for ankle mobility, ankle strengthening, as well as general balancing. So go ahead, give them a.
So there are different styles. Some are just rocking one direction and you turn them to rock the other direction. Some of them are circles like this one is. This is just OPTP brand wobble board. It's called Wobble Smart. I don't know if they still make this
just
one.
an OPTP.
Well, it's
They sell
superior OPTP.
Well, they do. They're a good
They make
company.
good product.
They
Yeah, our foam rollers are from them. They're
Yeah,
very nice.
They sell commercial grade or professional grade. You know, people in the clinic.
Yeah, so if you were really unsteady, most people want to try these. They're in our metal parallel bars at the clinic holding on. You can hold on to a countertop, something for support. If you're younger and you have good balance, you can do it that way. You can do side to side with these. It works your ankles, knees, and hips. You can go front to back with them like this. You can also do circles. That's the nice thing about the round ones, is you can do circles one direction and circles the other direction. You can also mess around with just balancing on them. So having it centered and balanced, and you can try it that way. There's lots of companies that make these. Some are plastic, some are wooden. Just make sure whatever is underneath, it doesn't slip, especially if you have like a linoleum floor. This one is kind of nice because it's actually got like grip already built into it. So it won't really slide. And then this one has different circles. Basically, it pushes out a spot in the center here, and the higher it gets, the more difficult it'll become. So that's just what these little dots mean. But now it's a lot harder. You can see it's raised up in comparison to level 1, which I think I have to go back the other way.
There you go.
So now it's flatter. So yeah, they're kind of fun little things if you have access to them or want one, but they're just nice to have.
There's discussion on some of the comments about tightening your shoelaces, and absolutely don't over tighten them, because we just talked about circulation in the foot. The tighter you get it, it's going to, it's one of those things where you want to keep it loose, but you have to have enough tension so your shoe stays on comfortably. One option that may work for some people is what I have here, these elastic shoelaces. They're handy. They're made for this situation. And the nice thing about it, you never have to tie and untie them, and they maintain, you can adjust how tight you want it around the foot so it's comfortable, not too tight, not too loose, easy to go on, go off. So you may want to entertain the thought of elastic shoelaces for eliminating over tight or too loose of a fit.
Now, seniors don't like to wobble on boards. This is true. Most of them remark at me when I make them do it, but it's good practice. Anyway, if you're really unsteady, don't do it on your own. Normally I'm holding on to people in the clinic, but a couple of things I do want to address before we're done, because we only got like 8 minutes left here, is to look at your walking mechanics and pattern. Some people, obviously, if you're older, you have a lot of arthritis, you have, whether it's a spine issue like stenosis, or maybe you have scoliosis or kyphosis, and your hips are really elevated and problematic.
Some kind of osis.
Just do what you can. It's kind of hard to correct a lot of those issues, especially if they've been occurring for years or decades. But if you are able to still kind of change your walking pattern, and you just have some joint stiffness or aches and pains, one thing to look at is how you're actually walking. So a lot of people nowadays will walk with a heel strike pattern. So the heel goes way out in front of them like this. Their foot is up. My knee is actually hyperextended right now. So I have a very straight knee. You're going to get a lot of impact forces going through your joint here before you proceed to roll over your foot. And now it's kind of normal when it's back here. But what you want to try to do is actually look at your walking pattern. So don't step with a locked out straight leg, but try to have a bent knee. If you just think about, hey, my knee is bent, your foot will kind of do what it's supposed to do and be more flat on the ground. You won't heel strike. It's going to feel quite odd initially, because most people are used to this pattern. They've been doing it for years. But try walking around without shoes on in your house, because it feels very uncomfortable to heel strike walking around when you don't have shoes on. You don't like that hard impact forces.
Mm-hmm.
A lot of the shoes we talked about earlier have the really built up cushion, which promotes heel striking. So when you get different footwear, as well as trying this, you're going to just start walking more naturally, how we normally walk without shoes on. This is going to put a lot less impact forces through your joints. So if you're having foot, ankle pain, knee pain, hip pain, back pain, just try it in your house initially and just see how it feels. If it feels comfortable, look into the footwear over time, and then try walking like that when you're out and about, obviously in your shoes. But you're going to have to go slower initially because it feels weird. I transitioned a few years ago. I used to lock my knees out all the time. I transitioned my walking a few years ago. Let me clarify this. So when you walk around outside, it's going to feel awkward at first. I'm not going to lie, but it gets better.
I actually want to mention, we've had people with active, in other words, right now, pain in their knee or their hip or their ankle while they walk, and then say, walk with a soft knee. So we educate them just like Mike did, how you forefoot comes down, slight bend in the knee. Think of the knee being over the foot, and they say, "Oh, wow, I don't have near as much pain in my foot just from doing this to doing this." And when it's like that, it's easy to train yourself because when you walk with a soft knee, slight bend in the knee on your forefoot, you have less pain or no pain. That's a really good feedback to correct it. So it's just something I wanted to bring up.
What exercises on the Bosu ball would you recommend for your feet?
Ooh.
Bosu balls are kind of fun. We don't have one here at the studio. So for people that don't know what a Bosu ball is, it's like a half ball and it's flat.
Mm-hmm.
So you can stand on it normal with the ball side up, or you can stand on the flat side. They're much more balance oriented than anything. If you're going to do on that for your foot, I would maybe try it without shoes on.
Yep.
If you're thinking about the foot itself, because it's going to make you curve your feet. You can do whatever. I've had people do step ups on it. So we'll just pretend the step is a Bosu ball. Because I don't have a Bosu ball here, but you can just step on it going forward. You can step up on them going sideways, holding on or not holding on. You can stand on them right side up or inverted, holding on to something, and you can try doing squats on them. It really, I don't have the ball here, but it really makes your feet and ankles shake because you have to have a lot of reaction forces. Other than that, I've had people do kind of like a side lunge on them too. I've even had athletes I'm rehabilitating put a whole band around them and step up on it because it pulls them back. So there's lots of different things you can try. But
Mike, are you familiar with this question? Sharon wants to know exercises on a Boosh, Boosh shoe ball.
I think she corrected it later. I think she meant to say Bosu.
That's the Bosu.
Yeah.
Oh, okay.
She just accidentally misspoke.
I thought there was a
I know too.
A new product out there that I wasn't aware of.
Yeah.
So okay, we cleared
Sharon
that
corrected it later.
Yeah.
Yeah, the Bosu.
Okay.
Vibration plates.
Have you ever been on one?
I've been on one, but not like a huge, like clinical version of one, just like a cheaper one. I mean, there's some research with like the clinical grade ones on like bone density and stuff. But it doesn't really like make you burn more calories or build strength or anything. But I have heard, good stuff with osteoporosis and vibration plates. But obviously, like the ones you can buy for home, I don't know any research on those specifically.
Yeah. I know my sister actually has one. She's got rheumatoid arthritis. And some other aches and pains, and she uses hers regularly and reports it's wonderful for her condition, and she really likes it. So again, it's newer product, it's not newer product, but that's is it a fad or is it something that's really going to help you? So I know I've been on one, and I'm up in the air. I'm in the fence whether they're. I don't think there's anything bad about one.
Yeah, I mean, if it's something you want to invest in and try it and you find it beneficial, that's fine. I just personally don't like use one, so I can't talk from experience. And I haven't really I don't have one at a clinic I work at either, so I don't really know.
I think that's something we're gonna spend more time over the next year to give people better information about that.
Anyway, that's probably going to kind of wrap it up for this live event. We'll be back next week at 10 a.m. Central Time. Again, we are going to be talking about stiff hand, wrist, finger pain, arthritis, kind of some exercises and stretches you can try. No, we are not occupational therapists, but we do work with them a lot, so we know some things about it. And I've had 2 hand surgeries, so I know quite a bit about hand issues. You don't have to be an
occupational therapist to know about hand. We study all the bones and muscles that an OT does.
Don't make me list them off the top of my head, though.
The OTs and
capitate,
PTs.
hamate, triquetrum. I don't remember the rest of them. Anyway, thank you for watching, and we'll be back again. Check out our pre-order on the iMaster Pro massage chair, and thank you for tuning in.
Very good. Have a good day, and as usual, be careful.